Bismillahirrahmanirrahim. Assalamualaikum everyone. Myself Dr. Maimuna Azhar. By profession I'm a physiotherapist and today I'm going to deliver a lecture on the subject of biomechanics while our topic is flexibility and injury. We have started a topic for joint flexibility and today we are going to learn flexibility and injury are how related. So the topic means and the topic says is how is injury related to flexibility? So what kind of the flexibility would a muscle have to have the high risk for injury? So we are going to clear that question. There would be increased risk of injury when there is decreased joint flexibility, increased joint flexibility, or imbalance between dominant and non-dominant side of the body. So there should be a balance in flexibility. The hyper and hypo both condition can create injuries. Severely decreased joint flexibility cause what kind of injury? And extremely loose muscles, extremely loose or extremely higher flexibility, what that will cause? In severely decreased joint flexibility, there would be increased tearing and rupture of the muscle during some activities which we are performing in ADLs and IADLs. ADLs mean activities of daily living and IADLs mean instrumental activities of daily living. What will happen when there is extremely high flexibility? It will result in displacement related injuries. So the both of the conditions where the flexibility is decreased and flexibility is higher, they are resulting in some kind of injuries, and these injuries are opposite to each other. Desired amount of flexibility is dependent upon individuals' activities. For example, gymnasts and dancers. They perform flexibility exercises daily. It's their routine part to do some stretchings and all the things which are required to do their activities. In those people and non-athletes, obviously there is a difference from earth to sun. The difference says that higher flexibility in the gymnasts and dancers and the lower flexibility in the people who are not doing activities, for example, non-athletes. But if they are having high flexibility, if gymnasts are having high flexibility, it does not mean they do not need strong ligaments and muscles. It means they also need strong ligaments and muscles to prevent themselves from injuries. So the next thing we are going to study that stretching before activity, how it will affect that. Before doing any strenuous activity, if we are stretching our muscle, we are preparing our body for that strenuous activity, we can prevent ourselves from some injuries. What are those injuries? Our body can prevent from those. Decreased incidence of muscle strain and decreased eccentric induced damage. And the point to ponder and point to remember is there would be no effect of stretch on overuse type of injuries. The muscle, the joints which are already overused, for example, we are using our shoulder joint too much in higher or in end range of motion. Due to overuse, the flexibility would already be increased, and due to that there would be no effect of stretching in these kind of injuries. One more point is considered that flexibility is dependent upon age. But we are going to clear that confusion today. This is the myth that flexibility is age dependent. No. Flexibility is not age dependent. When the age is increasing, flexibility is decreasing. This was the point which was considered in earlier times. But flexibility is mainly dependent upon physical activity. The way you keep yourself maintained. I have seen the people, I have seen the geriatric population very much well maintained, having high flexibility. But the youngsters who are sitting idle and are not performing any activity, they are having decreased flexibility. Regardless of age, if a person is not stretching their muscles, obviously shortening would occur. And regardless of age, if a person is stretching muscles, obviously lengthening of muscle would occur. So it will affect joint flexibility in this way. And the regular stretching and the training obviously will have a higher impact on our body, and it will lead towards the maintained flexibility of our joints. Thank you so much.